4 years ago, Larica Sampson gave birth to her first child. While it was one of the best days of her life, the experience was something she never wants to go through again.
Alan was actually born on the bathroom floor in my hospital room, in my labor and delivery room. And so I just didn't want that to happen again.
Let's move it to the beat.
While she was pregnant with her second child, she reached out to the nonprofit Mamey, which stands for Mobilizing African American Mothers Through Empowerment. The organization connected her with a doula, a professional labor assistant who provided Sampson with physical and emotional support during pregnancy, childbirth, and postpartum.
And having someone else there to advocate for me and to be able to help me, like when I was in a lot of pain, she was able to look at me and help me to focus and change into different positions that would help me labor easier.
Sampson's doula was Mamey Jackson, the founder and executive director of Mamey. Jackson now trains other doulas who work with mothers from the time they find out they're pregnant up until when the child is 2 years old.
We live currently in Durham, in one of the best medically advanced towns in the South. Healthcare is deemed exceptional here, but when you get down to the root and have community conversations, there is a major void that is happening, particularly for Black women and other birthing people of color.
The doulas ensure their mothers are going to the right providers, and if they're dealing with any high-risk complications, they connect them to specialized treatment.
So we like to work with the medical providers as a team member to ensure that they know what our clients' needs are and what their partner needs are, to ensure that everybody is working together as a team for better health outcomes.
And while Mamey's niche is doula support, they rely on their community partners to provide other resources for their mothers. One of their partners is Equity Before Birth, a nonprofit that provides paid leave and financial resources for Black mothers.
We know everyone needs support at some moment. We were all babies at some point. We all needed to lean on another human being. And so if there comes the time, and this is your time to need support, we want to be able to do that in the smoothest way possible and break down some of those barriers that families are seeing to accessing the care they need.
For Larica Sampson, she credits these organizations for guiding her through a smooth pre- and postpartum process with her second child. She now works with Mamey as an intake specialist and uses her experience to help mothers navigate what can be a complex and foreign process.
So many mothers are alone and they don't feel like they have help, but building an organization where you also have community partners helps grow their village, even though it's not just their family.